In order to learn about the lung pathologies, it is vital to understand the physiology, specifically of the airflow. Let's plot a graph for the lung volumes, which is the amount of air our respiratory system normally works upon. Tidal volume is the amount of air which is normally, that is involuntarily inspired or expired. Going beyond the tidal volume, the air inhaled by forced or voluntary action is the inspiratory reserve volume, also termed as the IRV. The air which is forcefully expired below the TV is the expiratory reserve volume, or the ERV. The remaining is the residual volume. One of the lung capacities involves the vital capacity, which is the additive sum of the IRV, TV, and the ERV. Vital capacity is denoted simply by Vc. If the vital capacity is forced or when external efforts are applied, time correlations will come into play. Therefore, given the facts and details of the vital capacity, if force is applied, in accordance to time, the vital capacity could be termed as the forced vital capacity, or the FVC, also termed as timed vital capacity. Now for this, let us create a graph for forced vital capacity, having relations with time on the x-axis. The volume is represented on the y-axis. After a few rounds of normal breathing, a deep breath is taken and forcefully expired later on. Time is measured. Given the facts, the inspiration requires 2 seconds and the forceful expiration would require 3 seconds. These 3 seconds can further be divided into 3 subclasses based on the amount of volume expired, that is the forced expiratory volume. Forced expiratory volume divided up into 3 groups, that is first second, second second, and the third second. In the first second, it is to be noted 90 to 95% of the expired volume is removed, followed by 98 and finally 99 to 100. This graph that we just created is of the normal physiology. The abnormal physiology would involve slight variations. The disorders can be thus divided as obstructive lung disorders and restrictive lung disorders. Let us first talk about the obstructive lung disorders. Obstruction, literally meaning some hindrance in the airway. Plotting the graph for the forced vital capacity, we find that initially there is normal inspiration. However, during expiration, we'll find that the time required for normal lung is 3 seconds, but for the obstructive lung disorders, it increases to 5 seconds. There is difficulty in expiring of the air. So time for expiration has increased. Clinically, this tells us that vital capacity, which has no relations with time, is completely normal. But forced vital capacity, or rather its subset, that is the forced expiratory volume in the first second, has reduced. In contrast to these facts, we have the restrictive lung disorders. What exactly are restrictions? Restrictions in the airway would prevent the inspiration of the air altogether. Therefore, plotting the graph of the forced vital capacity, we'll find that after normal bouts of normal inspiration expiration, that is the tidal wave, we'll see that the inspiration itself has reduced, time being the same. And the forced expiratory volume will also remain the same, the time of 3 seconds. Therefore, here we can say the reverse. the vital capacity has itself reduced, leaving the relatively new forced vital capacity normal.